Orthodontic treatment in patients with periodontal problems requires a comprehensive and multidisciplinary approach involving both the orthodontist and the periodontist. This is essential due to the increasing number of adult patients with periodontal disease seeking orthodontic correction. The key to success lies in proper planning and coordinated management of both treatments, considering the impact of orthodontics on periodontal tissues and ensuring adequate hygiene throughout the entire process. Periodontal disease, which includes both gingivitis and periodontitis, is characterized by inflammation and destruction of the supporting tissues of the teeth. Treatment should first address the inflammation and, in some cases, any bone defects. Regarding orthodontic treatment, orthodontics should not be performed during an active phase of periodontal disease, as it could exacerbate bone loss and tooth migration. Orthodontic treatment in these patients aims to improve tooth alignment and facilitate better oral hygiene, contributing to long-term periodontal stability. Furthermore, orthodontics in periodontal patients can improve dental aesthetics and function by correcting problems such as crowding, loss of vertical dimension, and posterior arch collapse.